Tonight, I'm going to present my access assessment for the Sunnyside Unified School District. The goals of this project were to create a suitability model that will evaluate access to healthy food and recreational resources for residents living within the Sunnyside Unified School District. I wanted to use GIS technology to build upon work being done by the Center of Excellence in Women's Health and also by Dr. Ada Wilkinson-Lee. In order to do this, I wanted to use a more refined approach than previous studies have used, including a network distance model and address points. Previous studies have used a Euclidean distance, which is a straight line distance, and census block centroids instead of address points. A network distance is more a better reflection of the ways in which people travel, and address points are just more accurate. So tonight I'm going to talk to you a little bit a background about food deserts and recreation deserts. I'll tell you a little bit about the study area, my data, how I got it, the analysis that I used, my results, and then what we can take away from those results. So food deserts are defined by the USDA as urban neighborhoods and rural towns without ready access to fresh, healthy, and affordable foods. And people who live in areas where access to healthy food is limited are more susceptible to obesity, diabetes, heart disease, and other chronic health issues. Studies have shown that recreational amenities are less abundant in areas where there's low income and high minority populations. And when you combine that with food desert issues, the health issues are compounded. And let me go back to that. One thing to note is open spaces may be available for people living in these areas, but they're often unsafe or aesthetically unpleasing, or they may lack appropriate resources for all types of segments of the population. So exercise resources are important for all segments of the population. My study area was the Sunnyside Unified School District boundary. I included all residents within the Sunnyside School District, not just students. The school district is approximately 93 square miles, has about 80,000 residents, comprising 19,000 households. It's largely minority, and about a quarter of the population is either low income or under the poverty threshold. And this is important because these populations are vulnerable to food insecurity and access issues. The good news is that this community has very deep roots, and many people within the Sunnyside Unified School District can trace their roots back several generations. And this is important because it creates ties to the community and also an incentive to advocate for change. So here's an overview of the study area. The Sunnyside School District is in blue, and you can see it in relation to the city of Tucson. The northern portion of the Tohono O'odham Nation San Xavier District is included in the Sunnyside Unified School District, as well as the Tucson International Airport and a portion of Davis-Montgomery Air Force Base. So my data was obtained from numerous sources, including Pima County, the Census Bureau, and Esri. All of my data was reprojected into the same state plane coordinate system. Residential address points were determined using the Pima County land use codes. Grocery stores, fast food stores, convenience stores, those were all determined by NAICS code, which is the North American Industry Classification Code, and also based on field studies that research assistants working with Dr. Wilkinson-Lee had provided. So I incorporated some extra stores in there that weren't necessarily classified as grocery stores. Based on field research, they knew that they had access to healthy foods at those locations. And since people are not constrained by the Sunnyside Unified School District boundary, I incorporated a 5-mile buffer around the school district boundary and included all supermarkets, parks, bus stops, and bike routes within that 5-mile buffer. So this is an overview of all of the address points within the Sunnyside Unified School District, the 5-mile buffer. And as you can see, there are no address points within the TO Nation, and that's because Pima County does not collect or maintain any information on the TO Nation. So any features within that boundary were excluded from my analysis. And this is just an example of how the features were incorporated into this 5-mile buffer. So anything within the school district boundary or this 5-mile buffer was included. Shown here are all the fast food locations, all the convenience stores, and the supermarkets, and similar maps were done for parks, bus routes, and bike stops as well. And just to note that in this area, there were about 700 fast food and convenience stores compared to about 29 or 30 grocery stores. So I used ArcGIS 10.1 for all of my analysis and mapping products. Specifically, I used Network Analyst and created an OD cost matrix. The OD cost matrix uses origin and destination points to calculate distances using a network path. In my case, the origin points were all the address points, and the destinations were either parks, supermarkets, bus stops, or bike routes. So in effect, I ran 4 different cost matrix models. I also incorporated a food balance score, and the food balance score is an equation developed by Mary Gallagher to indicate levels, relative levels of access to fast food versus grocery stores. So it creates sort of a saturation index that can show us which areas have better access to grocery stores versus fast food locations. All points were then converted to rasters and reclassified on a scale of 1 to 5. And then I used a weighted overlay and some raster calculator math to combine these models. A weighted overlay is sort of a more nuanced way to combine the various criteria when they're based on a common scale. We can weight each different criteria proportionally so that when they're combined, they equal 100%. And in order to determine which layer got which weight, I got input from the community and used that to base my weight classifications on. And again, another weighted overlay between the preliminary models to create the final surface that I will use for the rest of the analysis, which will be combining that final surface with census data to see what we can find. So here's an overview of my workflow. As you can see, there were 4 different features that went into the cost surface. And all the arrows are where the different features were weighted. And then the distance to grocery store and distance to fast food features were combined to form the food balance score. And then the cost and the food balance were also weighted and combined to form that final surface that I'm going to use for the rest of my analysis. So let's start by looking at the result of the cost surface. And this was the result. As you can see, there's a very small portion in the north where there is high access, and that means that those areas have the best access to parks, recreation, grocery stores, and parks, bus stops, bike routes, and grocery stores. And all of those areas in light yellow in the south and in the east have the lowest access to those 4 different features. And then all the other places fall somewhere in between. For the food balance score, this is the equation, the average distance to a supermarket divided by the average distance to a fast food location. And distances were derived from the line feature class that is produced from that OD cost matrix that I ran, and using some summary statistics. And then the graphic that you see here is, I used that scale to incorporate another reclassification on that 1 to 5 scale. So this is the result of the food balance score. And the high areas in this particular model are not good. They're highly saturated with fast food. So people living in these areas have greater access to fast food locations than they do to healthy food locations. And when there's access to fast food, when there's more easy access to fast food, the health effects are sort of intensified. So this is a useful metric to determine what areas are more at risk for those health issues. Okay, so the results, combining that cost surface with the feed balance surface, and weighing them to get the final suitability surface. I found approximately 50 households, which was less than 1% of the population, had good access to grocery stores, bike routes, and bus stops, and also had low food balance scores, so low saturation. Greater than 34% of those residents had poor access and high saturation. And the remaining households, about 65%, scored somewhere in between. So this is the result of the final surface, and that black box has a few little raster cells in it, which are the areas that scored the highest. So they have the best access combined with the lowest saturation. And then you can see there's a huge area in the south and the east as well that have low access, and their saturation is not good as well. So I wanted to continue the analysis a little bit and take that final surface and investigate it a little bit further. So I decided to incorporate some census data, and I wanted to start with income data and see where that went. So here's that final surface with the census block group data for income overlaid. And the poverty threshold for 2012 for a family of 4 was $22,492. So a couple areas on the map stood out to me pretty quickly. There's an area in the north where they're within a poverty threshold, and they only have moderate access. And then the area in the south has low income and low access. So these are areas that could be of concern because they might not have the ability to access healthy food resources. So I pulled out those areas, and this was the result. And then I wanted to look at vehicle access. So again, another census block group data. And this is where people are reporting in their households whether or not they have access to a vehicle. So there's 3 census block groups here that are reporting greater than 10%. The households have no vehicle whatsoever. So when I pull out those residential areas, we get these residential areas that are in areas where greater than 10% of the households are reporting no vehicle. So then I want to see if any of those areas overlapped. So any areas where there's poverty or low income, low or moderate access, and also most likely to lack a personal vehicle. And the goal of this was to be able to focus resource and have the most impact. So again, here's the income raster. Greater than 10% people were reporting a vehicle. And then as you can see, we did have an overlap. So this area in the north in red is an area that has low income or poverty, moderate or low access, and also the least access to personal vehicle. So in conclusion, using this analysis, I was able to identify several areas of greatest need using different measures and indices. It turns out that very few residents in this area have high access access and low saturation. So there are social and community justice issues that are related to this, food insecurity, land use policy, resource allocation being just a few of those issues. And I think continued community involvement and advocating for the people living in this area is going to be really important. And of course, using GIS to continue to tackle this problem and try and find solutions. And here are some acknowledgments. I would specifically like to thank Dr. Ada Wilkinson-Lee and Alexandra Armenta for all their help in proposing this project for me. And questions?
Why did you use the school district as the political boundary, not other districts?
I was working with Dr. Ada Wilkinson-Lee, and that's the area that they're researching for their purposes. So we just decided to stick with that boundary.
How easy would it be to pick another area? I mean, did you use a model to do all this? Or?
Well, that was one of the things that when I was originally doing this project was thinking about having somebody else in the cohort do the same thing but with a different school district. Maybe some people talk about the Catalina school district and trying to compare those, but I don't see any reason why that couldn't be done. It was pretty straightforward.
Thank you, Liz.